She's a front-end developer. She has come to your pharmacy and she has had treatments, failed malaria treatments. Let's say she has come every 3 weeks for the past 2 months, and you're just wondering what has happened or what's going on with Aisha. Of course, you can tell that this has disrupted her day-to-day activity and also her productivity at work, right? And she needs your help. So what are we going to do differently for Aisha? We also have a world trend map, a lot of things that happen over time, and this is showing treatment failure across several countries in the African space. Like I mentioned, there's been a lot of innovations, and with time, we are beginning to see an increasing trend of treatment failure. This is a map showing treatment failure across African countries for artemether lumefantrine, diadratin, peppercorn, and artesunate pyridine, which is what is in Pyramax, right? So the main challenge with this data is not just the spread, it's the percentage of the spread, about 10 to 20%, meaning that in 100% who are treated with artemether lumefantrine, there's been recorded failure rates of about 10 to 20% of that population. I mean, if that was one person that's 1% or 2% in 10% each time treated with artemether lumefantrine and diadratin over time. Now there's a need to introduce something different, right? And apart from the fact that we are having these figures, there are also been identified factors contributing to increasing resistance. Number one, we have drug pressure. We have subtherapeutic dosing. Are you with me, please? Yeah. If you are with me, say check. Check. If you are with me, say check. Alright, so I said that we have quite a number of resistant drivers. The first one is the drug pressure, and the next is the subtherapeutic drug level. We have low adherence and reduced drug sensitivity. So for the drug pressure, quite a number of healthcare professionals, we use the front line. Before now, we have the two first line medications, that's artemether lumefantrine and artesunate and modalquine. But you can tell that a lot of pressure has gone on artemether lumefantrine due to recommendation, and also for on the part of the patients, a lot of us. I know there are quite a number of people like me who don't complete their artemether lumefantrine dosage. That last tablet, there's always something about that last tablet that does not work. That's the last one. You just give it for whoever you want to give it for, and also for subtherapeutic drug levels. So apart from the fact that we've had quite a number of interventions, and at this point I'd like us to give it up for NAFDAC. They've done a lot. They've done a lot to curb the increasing counterfeit drugs in the market, right? They've done a lot, but then also with regards to the dosing and drug level, a number of us do not take our adequate dose per time, right? And then these cases of reduced drug sensitivity also due to overexposure or low adherence to our medications, right? So the two major constraints of the resistant drivers are the drug pressure and low compliance. Drug pressure and what?
Low compliance.
Drug pressure and what? Low compliance. And it's very, very important that we need a new ACT to combat these two major factors. Now, adopting a new ACT is critical. At this point, I would like us to take a look at something innovative in the malaria space. I want you to pay rapt attention as we introduce to you the latest ACT recommended by the World Health Organization. Please watch your screens. Thank you. Alright, great. If you watch that less than 30 seconds video, you will see quite a number of innovations. You'll see quite a number of details that go into that. Right, so Pyramax is the first and only fixed dose combination of pyridine and artesunate. artesunate is quite, we've used it in some of our facilities, but pyranoridine seems new to many of us, right? And like I mentioned, it's the latest ACT recommended by the World Health Organization. Again, I want us to remember this about Pyramax. Pyramax is potent. Can you say after me? Pyramax is potent.
Pyramax is potent.
Pyramax is reliable.
Pyramax is reliable.
And Pyramax is simple.
Pyramax is simple.
Okay, so let me just take you through a number of trials, details around that. So first of all, like I mentioned, this is the latest ACT recommended by the World Health Organization. So if you played the game yesterday, this was one of the questions. What year was artesunate pyranoridine added to the WHO treatment guideline? It was added in 2022. You can still come today if you still want to play the game again. And also adopted across different sub-Saharan African countries, with Nigeria not taking any seat at the back. We have Nigeria also adopting Pyramax or pyranoridine artesunate as a multiple first line as of 2020. Right. So, what are the different clinical studies that have been done to should I say, speak to the potency of Pyramax? The first one is the Wanicam study. Please, I would like us to pay rapt attention at this point because you will need some of these information to engage your clients or your patients. Now, the Wanicam study was done in Mali, Burkina Faso, and Guinea. And at the end of this study, which was a randomized study, Pyramax came up. At the end of this study, we had 3 major points from the use of Pyramax. The first one is the excellent cure rate. The first one is what?
Excellent cure rate.
The first one is excellent cure rate at day 28 rather, of about 99.8%. Moving that forward to day 42, we had an excellent cure rate of 99.6%. Now, another interesting thing about Pyramax is the fast parasite clearance time of about 24.7 hours compared to atemtalumefantrin that takes about 34.5 hours. Now, speaking to the parasite clearance time, it means that within the shortest possible time, there will be resolution of symptoms and your patient will be able to get back to work in the shortest possible time. At this point, I think you can give a round of applause to Pyramax. Okay, so next, like also speaking to post-treatment protection, because of the long half-life of pyranoridine molecule in the combination we have, pyranoridine has an half-life of 14 to 18 days. So you would still have the molecule in the system even after the use for 3 days, which speaks to the potency of the medication even after your 3-day use. And we've had this study also speaking to the post-treatment protection of about 96.6% parasitological and clinical response at day 28 of about 96.9%, and also at day 42, that's 6 weeks after the first use, of about 81.5%. Right. We also had a localized study in the pediatric population, like the first presenter mentioned, that we have children above 5 years being prone to malaria much more than the other part of the population, right? This study, at the end of the study, going head by head with atemtalumefantrin, Pyramax was said to be safe, tolerable, and the good part about the Pyramax molecule for children is that you can mix it with milk or juice, makes it more tolerable for the pediatric population, and then it has a fast parasite clearance time, also applicable to the pediatric population. Speaking to the reliability of Pyramax, in the real-life study that was done of over 7,000 patients, one of the wildest, should I say, one of the largest studies done so far in the malaria space, we have a CANTAM study. And this study showed the effectiveness of Pyramax after 28 days at 98.6%. At 98.6%, right? Compared to atemtalumefantrin and artesunate amlodipine, with the WHO threshold being 90%, we were able to come out with a whopping 98.6% effectiveness after 28 days. Aisha is still in your facility and you're thinking of what to give her. She has used quite a number of ACTs. Why don't you break the cycle of treatment failure with Pyramax for your patient like Aisha? If Aisha was me, if Aisha was your sister, you would want to give her something different, right? And what to give her is Pyramax. What to give her is what? Pyramax. What to give her is what? Pyramax. Alright, so let's speak to the simplicity of Pyramax. Pyramax is used just once a day day, right? Once a day for 3 days, and the number of tablets is based on the weight of the patient. Like I mentioned, we have the microencapsulated granules for children, makes it easier for them to use. It can be taken with or without food. Pyramax can be taken with or without food and is well tolerated across every age range. Again, speaking to the dosing, like I mentioned, it's used just once a day for 3 days. So to break down this dosing, we might have to have more engagement at the booth. But one thing you should know is that from 65 kg and above, we will use 4 tablets once a day for 3 days. Film coated, taste masked, odor masked tablets. Thank you very much. Again, just to cap it all up, once daily dosing with efficacy against Plasmodium falciparum and Plasmodium vivax is safe and has the same efficacy with or without food. And you don't have a limited number of treatments per year, meaning Pyramax can be used over and over again. You don't have to use it just twice a year, even if you have to treat malaria again, right? Now, I said Pyramax is potent. Pyramax is what? And Pyramax is potent. And Pyramax is simple. I've been able to show us the excellent cure rate of Pyramax, the fast parasite clearance, the post-treatment protection, the simplicity of use, and the boost for compliance, especially after the real-life study was done. Like Aisha again, your front-end developer, your pharmacist friend, your medical doctor, why won't you choose innovation, choose impact, and choose Pyramax? Thank you very much.
Thank you so much, Pyramax. That's a nice presentation. The balance in viruses. One